Good evening, everyone, and thank you for joining us for our My Health Record update webinar tonight. I'd like to start by acknowledging the traditional owners of the land on which we're meeting today. I would like to pay my respects to the elders, past, present, and emerging. So welcome everyone today to our webinar event, and thank you for attending. The majority of webinar events are recorded and freely available on our PHN Learn YouTube channel. We do have a practice communique we send out to all practices fortnightly with valuable information, including an external calendar of events and internal calendar events. You can also find all of our latest education on our website, and a few upcoming events are highlighted on this slide. During this evening's webinar, participants will remain on mute. If you have any questions, please type them into the question box. We will ask all questions on your behalf anonymously during question and answer breaks. Our presenter for this evening is Jenny from the Digital Health Agency. Please note of the Westvic PHN Health Pathway slide relating to this topic, and that's available on the screen at the moment. There is a flyer in the handout section for you to download, which contains the information and the log-on details. Once again, thanks for coming along, and I'll hand over to Jenny to start this presentation.
Thank you so much. I'm just going give me 1 second to share my screen. Everyone should be able to see that now. If there's any issues, feel free to pop a message into the chat pane and we'll monitor that, and I'm sure somebody can let me know if there's any problems seeing my screen. Welcome to the webinar today. We are talking about My Health Record. Today, I'm providing you with an update into how to use My Health Record for the purposes of delivering immunizations, and also we'll have a look at pathology e-requesting. Before I make a start, on behalf of the Australian Digital Health Agency, I would like to acknowledge the traditional owners of country throughout Australia and their continuing connection to land, sea, and community. I would also like to pay my respects to their cultures, to elders, both past and present as well. So on the agenda today, we are looking at My Health Record, some of the key clinical information that you can find in a patient's My Health Record. Obviously, considering that everyone's focus now is on the rollout of COVID vaccinations across Australia, we're going to look at My Health Records as a tool that you can use to view, for example, patients' allergies and adverse reactions information. We'll also talk about the importance of uploading shared health summaries for your patients, and I'm definitely going to explain some of the latest enhancements that have been made to the My Health Record system when it comes to viewing patients' immunization records. We're also going to look at how you can make sure that your patient's pathology results can be uploaded to their My Health Record as well, and how pathology e-requesting can play a role in that process. And then at the end, we'll stop and go through any questions that you guys have, and you're absolutely welcome to post them in the chat or the questions pane on the right hand side, and yeah, we'll respond to them at the end. So I'm sure everyone on the line today is already quite familiar with the My Health Record system, but obviously just a couple of points to mention as a bit of a refresher. It is an online summary of an individual's key health information, and healthcare providers who are involved in an episode of care for a patient are authorized to view this information, and you are also authorized to upload information to patients' My Health records. It is something that is personally controlled, so patients themselves can view this information. They can contribute to their own My Health record by adding their own sort of information to it. They also choose what information gets uploaded. So, for example, if a patient doesn't want something shared with their My Health record, they can let you, as the healthcare provider, know. And then you need to comply with these requests and make sure you don't upload something. But otherwise, as I said, under the My Health Records Act, which is the legislation that governs My Health record, you are authorized to upload information to a patient's record. They also decide what information remains in their record and who can see it by setting certain sort of access controls to protect their information if they like. Now, at the moment, over 90% of Australians have a My Health Record system, have their own individual My Health record. 85% of records now have data in them as well. At the moment, there's over 2.5 billion documents that have already been uploaded to the system. That includes pathology, test results, medical histories, medicines records as well. And the agency is constantly working on connecting more healthcare providers to the system, encouraging more healthcare providers to upload information to patients' My Health records and also to view that information. We have been working a lot this year and in the past year as well on getting more specialists connected, more private hospitals involved as well, so that we can get more information in patients' My Health records. And we're going to chat later in the presentation as well about which pathology labs are also now connected to the My Health record system, which is something that we have been working on a little bit in the past as well. So in the My Health record system, there are three main types of documents that you can find. As I said, there are patient documents that patients themselves can add to their records. So it's things like their personal health notes, advanced care planning documents, emergency contacts, and things like that. They can add their own allergy information, for example. And that's fairly straightforward. They jump onto MyGov and to the consumer portal where they can add this information in if they like. Other information also comes from Medicare. So we have Medicare Documents. That does include MBS and PBS data. So any claims that are processed by Medicare for the patient, they are uploaded to the relevant patient's My Health records as well. That document type, I suppose, the Medicare Documents, does also include information from the Australian Organ Donor Register and the Australian Immunisation Register as well. So at the moment, this is classed under Medicare Documents, and we're going to come back to the Immunisations Register later in the presentation as well. The last category is the provider documents. So these are the documents that healthcare providers themselves can contribute to a patient's My Health record. So these can be uploaded from general practices, can be by hospitals, community pharmacies, diagnostic imaging providers, and pathology laboratories as well. So there's lots of different types of documents, and in addition to the different individual documents that you will find in a patient's My Health record, there are also a couple of different views that are available as well that sort of collate certain information in one area to try and make it a bit easier for you to find information. So throughout the presentation today, I will keep referring to different types of views as well. So if we start to have a think about how you might consider using My Health Record as part of your COVID vaccination rollout process, one of the things that you might want to check could be a patient's list of allergies and adverse reactions, for example. So that's where My Health Record can definitely be used, and the best place for you to find this information in a patient's My Health record would be through their medicines view. So this medicines view or medicines information view, or in your clinical software, it might also be called medicines overview. But basically what this view does is it consolidates all information that is related to medicines specifically and puts it into one sort of area for you. And of course, the first tab here that you will find is the allergies and adverse reactions, the pink sort of section, and you can see exactly what medicine a patient has had a reaction or an allergy to, or what agent. Maybe it was a vaccination that they've had in the past. All of this information can be recorded, and then you will also see the source of where this information came from as well. So whether it was submitted by a hospital as part of a discharge summary for the patient, or if the patient themselves have uploaded a personal health note, for example, this information can carry across into this allergies and adverse reactions area. So that's where you will find that information. The other really helpful document is the shared health summary. Now, this is uploaded by a patient's nominated healthcare provider. So generally it is someone who looks after the patient quite closely, their regular sort of practitioner, most likely their regular GP, but it can also be uploaded by a registered nurse at the practice, for example, or an Aboriginal and Torres Strait Islander health practitioner as well. So those are the three types of professions or types of healthcare provider who can actually authorize this document, so the shared health summary. Now, a shared health summary is a patient's health status at a point in time. So a summary of their health status at the point of when this document was actually uploaded. It includes four key areas of information. We have adverse reactions, we have medications, medical history, and any administered immunizations as well that maybe were administered at your clinic, and you would have a record of them in your local patient's sort of record. Now, this is a document that is very good to be uploading for your patients at the moment, especially those who are under 75 who have underlying medical conditions that might prove their eligibility for say the phase 1B category to be vaccinated for COVID. So if you think that someone you are looking after, one of your patients, would qualify for that category, and say if they go to a different clinic to try and get their COVID-19 vaccination, they might be asked to prove their eligibility, and the patient can use this document as a supporting sort of document to prove what their medical conditions are. So this is something they can access if they log on to their own My Health record, or that clinic that is delivering the immunization for the patient, for example. They can review this document and confirm that the patient qualifies for a certain sort of category of immunization. Most importantly, most of you who dialed into the session today are probably wondering how you can view someone's vaccination status or their immunization record. And again, My Health Record is something that does contain this information. So if you're looking for someone's immunizations record, My Health Record is one of your options. Your other options would be to access the Australian Immunisation Register directly. So you can log into PRODA, you can access the Australian Immunisation Register there, but My Health Record is a much easier way of getting to this same information. You can access My Health Record quite easily through your clinical software. You don't need to open any other browsers. You don't need to log in or anything like that. It's quite straightforward for you to access the Australian Immunisation Register data through a patient's My Health Record. So all you need to know really is how to find this information through your software. So let's have a bit of a look at that. So the Australian Immunisation Register, or AIR for short, is a national register that records all vaccines given to all people in Australia. It is now mandatory for you to report COVID and flu vaccinations to the Australian Immunisation Register, and I believe all other vaccinations will be mandatory for reporting as of the 1st of July this year as well. In the past, perhaps not all immunisations may have been uploaded to the Australian Immunisation Register. It was only expanded to include adult immunisations in September of 2016. So prior to that, some of the childhood immunisations may not be sort of visible. But now you will be seeing a lot more immunization records in the AIR, because it is mandatory to report all of those vaccinations to AIR. Now, the Australian Immunisation Register feeds into the My Health Record system, and that is why you can see the same data as you would in the Australian Immunisation Register in a patient's My Health Record if you have a look. Now, it lives in your clinical software. If you use your clinical software platform, it lives under Medicare Overview. So in order to find the Medicare Overview, in some of the software platforms that you're using, you may need to enable certain filters. So for example, some software may be excluding Medicare documents, so there might be a tick box that you need to untick and then update to make sure that you can see the Medicare overview in your list of documents. Otherwise, it might be a filter that you need to enable. So you might need to tick Medicare Overview, for example, to make sure that you can actually view it in the patient's document list once you've opened up their My Health Record. And then you'll be able to open up the Medicare Overview to be able to actually have a look at that information. So here you can see we've selected the right filters. We now can see the Medicare Overview in the document list. There are sometimes options for you to access information from the past 12 months, for example, or the option for you to view all information. I suggest you use the all version just to make sure that there's nothing missing and there's the most sort of up-to-date information. The whole picture is presented to you. So you would select the Medicare Overview All option once you've enabled those filters, and then you will be able to get into the Medicare Overview. Now, again, Medicare Overview is a type of a view that consolidates different sort of information. So I said that earlier on, Medicare information also included things like PBS information, for example. So that is the first thing you will see in this view when you open it up. But once you scroll down, the second section is the Australian Immunisation Register data. So that is basically where you will be able to see at the moment all Australian Immunisation Register data for this patient. Now, if you do want to have a practical sort of hands-on demonstration of how to get to the Medicare overview, how to look at this AIR data, feel free to join one of our virtual classroom sessions. We are running them for different types of software platforms. You can choose the one you're currently using at your practice, and we go through the different steps of how to view the Australian immunisation data through Medicare Overview, or how to upload a shared health summary, for example. We go through all the steps. So this information is available on our website, the Australian Digital Health Agency's website. You can go to the events page and register for these sessions. Otherwise, we will make sure that we send you a copy of these slides today as well. You can follow the links and join the session that suits you at a time that suits you. So I hope to see you there if you are after more of a practical sort of hands-on demonstration. So let's have a chat now about some of the latest enhancements that have been made recently to the My Health Record system, specifically for the purpose of sort of accessing immunizations information. So as I said, at the moment, immunization information from the Australian Immunisation Register is available through the Medicare Overview section. Then in February, there was a new consolidated immunisation view that was made available through the National Provider Portal and the National Consumer Portal as well, which increases visibility of immunisation information in the My Health Record system. So basically what that means is that if you were not using your clinical software, if you were to jump on through PROTA HPOS to the National Provider Portal, or if you even wanted to just have a look at your own My Health Record through the National Consumer Portal, you will notice that there is now a new immunizations view. There's a new tab that you can see that contains immunization information. In May, what is going to be happening, which is in 2 weeks' time, really, we are going to be releasing an update to the My Health Record system and basically making this immunization view also available through your clinical software. So that is something that you have to look forward to. You will be able to see the same immunization view, which is currently already available through the National Provider Portal. You will be able to see that in your clinical software. So you won't have to go looking for the Medicare overview anymore once that happens. So that's in 2 weeks' time. You will be then looking for a new immunizations view tab in your software, or it might be a new sort of document type. There might be a new filter that you need to enable, so just watch out for that. But it will make sure that you can see more immunization sort of information directly through your software. Yeah, we'll have a look at what that actually looks like if you were to go into something like the National Provider Portal, for example. If you're not familiar with the National Provider Portal, it's a way for you to access the My Health Record system of your patient through a web browser, and it's a view-only platform. So it means you can't upload any information to it, but you can absolutely view a patient's My Health Record. So previously, as I said, even in the National Provider Portal, you would have to have looked for the Medicare overview to find that AIR data. Now there is a new immunization records tab that you have access to. So basically, the AIR data has now been removed from the Medicare Overview sort of area, and there is now a new immunization records tab. The really good thing about the new immunizations tab is that it gives you more immunizations history information. So previously you would only have records from the Australian Immunisation Register, so only the vaccinations that have been actually recorded in the Australian Immunisation Register. If something was missing, if something wasn't uploaded to AIR, wasn't reported to AIR in the past because it wasn't mandatory to report all vaccinations in the past, then you basically wouldn't have been able to see those immunisation records in the AIR sort of area. But you may also recall that, say, for a shared health summary, there is an area for you to include immunizations information there. So if you uploaded a shared health summary, for example, and you didn't share the data with the Australian Immunisation Register, you would only see that information if you actually opened up the shared health summary document. So in the past, the Medicare Overview maybe didn't provide you with the full sort of picture, whereas now the Immunizations Records tab contains immunization information from AIR as well as other documents in a patient's My Health record. So if somebody did upload a shared health summary, for example, or an event summary is another document where you can add immunizations, a vaccination record, for example, then you will see all of those records as part of a patient's immunization history. So there is a filter. You can choose which source of information you would like to look at, if you want to have a look at all of them, or if you just want to look at AIR data, or if you're happy to look at other documents, for example, you will be able to clearly see what types of vaccines a patient has had, and the source of that information as well. You'll also notice that there is the next immunizations due area. So basically the alert or reminder option here, which was not previously available. It is currently only operating for COVID vaccinations, but basically it will tell you when the patient is due for their second dose and which vaccination it needs to be, and the date of when they're due for that vaccination. Again, in the National Provider Portal, these alerts will appear as part of the Immunisation Records tab, but also if you just logged into a patient's My Health record, there is usually the health record overview page, and there is an alert section on that page as well with the next dose due. So very handy, and something, as I said, for you to look forward to. You'll be able to see something very similar through your clinical software systems as of May, when the new release comes out. Now, we spoke about My Health record being one of the ways in which you can view a patient's immunization record, but as we've been saying, it is also obviously very important that you have a way of uploading vaccinations records to AIR for the patient. So there are, again, different ways you can do that, your clinical software system that you're currently using probably has a way of uploading vaccination records to AIR. So if you're not too sure, you can contact your software vendor, your software provider, to find out a bit more information about how that process takes place, what you need to do to make sure that you are complying with this requirement to upload vaccination records to AIR. Your other option is to access AIR through Proda, but if that is challenging, or if you don't have a software that has the capability to upload those vaccination records to AIR, then you do have another option, and that is the Clinician Vaccine Integrated Platform, or CVIP for short. Now, CVIP is an agency designed digital solution, or it's an application that basically supports this process. So it supports the uploading of COVID-19 vaccine administration to the Australian Immunisation Register, and it's meant for those vaccine administrators who don't have another way of sharing that information with AIR. So as I said, if you don't have the software that can do it, or it's not sort of efficient enough for you to use Proda, for example, then CVIP is something that you can consider. There are options, or I guess additional functionality that CVIP does offer you in terms of meeting the requirements to check for previous vaccine encounters. So you can actually view a patient's immunization history through the CVIP platform. You don't need to go into AIR to have a look at someone's previous immunization history. You don't need to get into their My Health record to check it. You can do it through the platform, and of course it will support the upload of that vaccine record to AIR. It is something that can be accessed through a web browser, or it can be downloaded as an app as well. So if this is something that you are considering for your practices, then there is absolutely more information available on our website. So I encourage you to go there and have a bit of a read to see if that is something that you might potentially use. And you can contact us through the website, or there is a helpline as well if you have any questions about that, if you need assistance in setting that up. But otherwise, I hope that makes it clear for everyone how to view someone's immunization history through My Health record, for example. I know there's a couple of different ways I've covered today. Again, happy to answer any questions that you have at the end of the session. But otherwise, I might move on and have a look at pathology requesting as well. So basically what we want is to make sure that you understand how you can contribute your patient's pathology test results with their My Health record. How can you actually make sure that those test results can be uploaded to a patient's My Health record? I showed you a couple of different views earlier on. So we had a look at the medicines information view, for example, that had the allergies and the adverse reactions areas. We had a look at the Medicare overview as one of the areas where you can see the AIR data. There are also two other views that are available through your clinical software platforms. So that is the Diagnostic Imaging Reports Overview and the Pathology Reports Overview as well. So basically what the Pathology Reports Overview does, again, it collates any sort of test results, any reports that have been shared with the patient's My Health record, puts it all into a really nice tidy view for you. There's a couple of ways you can sort and filter information to find the report that you might be after, and a way you can use this, for example, is if a patient has been in a hospital recently, you want to review what tests were done while the patient was in the hospital, or you have a new patient that presents to your clinic and they say that they've had some test results done recently through a different practitioner. You might want to review those test results as part of your consultation. So instead of having to ring up to try and get that information directly from the pathology, you can try their My Health record to see if those test results have been shared. So it can be very handy. You can organize things by organization, for example, or the lab that completed the test. You can put them in date order to find the most recent test results, or you can put them in alphabetical order if you were looking for a specific sort of test. And then, of course, there's going to be a link in there that you can click on that will open up the actual pathology report for you. And that way you can view those test results. Now, the agency has been putting a lot of work into getting more diagnostic imaging providers connected and more pathology providers connected. And there is a list available on the My Health Record website. I've got the link here for you, which you can have a look at, that lists all the diagnostic imaging providers and all the pathology providers who have the ability, the functionality to upload a patient's test results to My Health Records. So they're all listed on there as, if they are actually able to upload someone's result to My Health Record. The trick with that is that some of the pathology providers, in order to actually upload someone's report to My Health Record, they have, or they may have, some requirements. So some of these pathology providers may need the actual request for the test to be done as an e-request. So that is why we're having a look at that today, to make sure that you sort of understand why it may be necessary for you to be set up for e-requesting at your practice. So I've got some example sort of screenshots. So this is what your regular pathology request would look like, just a paper sort of printout. You've got the test details and so forth on it. Now this is what an e-request looks like, or an electronic request for a pathology test. Now the trick is that we call it an electronic request, but you would still print it out on paper. So it will look very similar to your other sort of standard pathology request, but on paper, there will be a barcode on this piece of paper if your test order has been completed as an e-request, an electronic request, or an e-order. It has many different terms, but basically you want to watch out for this barcode on your printed forms that you give to your patient, and they can take it to that laboratory that, in case they do have this e-requesting requirement. And what that means is now that you have done an e-request, the patient can take this piece of paper to that laboratory, and they will basically be able to scan this barcode, and it will save them a lot of time when it comes to processing this request. So they won't have to manually enter any of the patient's information because the barcode is there. They can scan it, and that will appear on their screen, and they will just double check the details. And that means that they should be able to upload the test result for the patient into their My Health record, because that's something that you have set up. And we're going to have a look at the some of the other sort of requirements and the steps that might be involved in setting up your clinic, but that may be one of the requirements to be able to have those results uploaded to a My Health record. if we have a look at some of the benefits of using an electronic request, basically, in order to avoid duplication of tests, obviously it would be really great if we could make sure that the pathology provider can upload reports to the My Health Record system. So whatever their requirements are, whether it's an e-request, we want to make sure that when you are completing that form, you're doing it in the way that the pathology provider can process to make sure that they can upload that result to a patient's My Health Record. It is a lot quicker for processing of the actual report. As I said, the lab basically just needs to scan the barcode on the form. They don't have to manually enter any data in, so there's a lot less chance for any transcription errors and so forth. So it does make the process a lot more streamlined. There is not really any change to your workflow at all. So once you have been set up, once your practice has been set up with the lab, the e-requesting is enabled, there's not really any change to your workflow. So you still print out the piece of paper and you hand it over to the patient, but you just want to make sure that that barcode is present to make sure that the lab can process it. And basically that will, enable our patients to be able to view their results in their My Health Record. Now, as I said, there may be some other requirements depending on the laboratory that you do refer your patients to. So I definitely encourage you to have a look at the list on the My Health Record website, and it goes through all the different pathology providers who have the ability to upload results to My Health Record, and if there are any requirements, then those will be listed. Apart from needing to be an e-request for some of the pathology providers, there may also be requirements for you to use a certain version of your clinical information system. So make sure you are using one of these systems to be able to issue the e-request, for example. There is contact details available here, so if you need to contact any sort of specific lab to talk to them about setting up your requesting, or some laboratories may need you to simply contact the lab and let them know that you are interested in your patient's test results being uploaded to My Health Record. So it may just be a phone call. So these are provided for you here if you need to get in touch with them, or you can absolutely reach out to your PHN and they can definitely assist you through that process as well. In terms of the pathology providers in your sort of region, for example, I know that Dorovich have no requirements at all, so you can refer any of your patients. It doesn't matter what software platform you're using, it doesn't matter what version of the software platform you're using, or whether or not you've been set up for e-requesting. They don't have any requirements. So if you send patients to that particular lab, then their test results will be shared with their My Health Record, which is really great. Other labs that maybe are in your area could be the Melbourne Pathology Provider. They do require e-requesting to be enabled. So if Melbourne Pathology is one of the providers you refer to, then you do need to be set up for e-requesting. They would have a requirement for which software you need to be using, and you do need to contact the lab directly to let them know that you want your patient's test results to be uploaded to the My Health Record system. So once that's done, you can refer patients there. Your patients can still go to any other lab if they choose, for example. They don't necessarily have to go to that one lab because you've been set up for e-requesting with them. They can still go to a different laboratory if they choose to go to Dorovich, for example. There's no requirement, so they can have their results uploaded. Otherwise, if they go to a different laboratory provider that has some other requirements, then that just means that their records may not be uploaded to their My Health Record system, for example, but they will, of course, still have their test done, and you will get their results through your regular sort of channels. I also know that ACL are able to upload patients' results to the My Health Record system as well. Again, feel free to get in touch with them and confirm what are some of those requirements that may need to be met. But certainly we know that we've been doing a lot of work with these pathology providers, and a lot of them do have the functionality now to upload results to patients' My Health Record. It's just that you may need to meet some of these requirements with them. So I would encourage your practice manager, for example, to get in touch with your local labs or get in touch with the PHN just to confirm if the setup is correct, to make sure that your patient's results can be shared. So that's it from me at the moment. I'm happy to address any questions that may have come up during the session. If you have anything for me you'd like to ask, or if there's anything you'd like to confirm, happy to answer them now. Helene, were there many that have come through? Oh, yep.
We haven't had any questions, Jenny. Is there any further questions for Jenny? It's a good opportunity while she's here to ask anything that you may be thinking regarding either the uploading to My Health Records or electronic requesting. No?
I think also with ACL, I believe there is an option for telehealth appointments to actually process the sort of pathology request electronically, so you may not need to print out the form and give it to the patient. There's actually a way that they can just get it on their phone, similar to how an electronic script works, which is very handy these days. But you do need to be using certain sort of software as well. So there are many, many ways in which you can, make sure that your patient's results can be shared with My Health Record. So make sure you inquire with us if you do have any questions about that.
Yeah, great. Thank you, Jenny. Thanks for tonight, and thanks for a great presentation. And thank you for everyone for attending. And please get in touch. I've popped the digital health email address in the chat. So please, if you do think of any questions, send them to the email and we'll answer them for you. Thank you. Thanks again, Jenny.
Thanks so much, everyone. Have a good night.